Alright, so my name is Jillian Frank and this is my basic assessment video. Thank you for watching. Jessica, I already got consent from her to be my patient. And so to start off my assessment, I want to make sure that the patient has privacy, good lighting. I'm going to go ahead and introduce myself to you. My name is Jolene. Thank you for seeing me today. Also, I'm going to just verbalize that she had great vital signs, her BMI, height, and everything was within normal parameters. So as we go through your assessment today, I want you to make sure that you tell me anything that has discomfort or that you're having issues with, okay? So just looking at Jessica, she looks like she's dressed appropriately, she has good nutrition, she doesn't appear to be in any immediate distress. So I'm going to go ahead and start with her skin, hair, and nails. She looks like she's got good hair distribution, no patches, no lesions, no nothing like that. Skin looks to be in normal, it looks like it's in good integrity. She's got good skin sugar. Nails look good, appropriate. She doesn't have any pitting. No clubbing of her fingernails or fingers. She's got good cap refill. And her skin looks dry and intact. So as far as her nails, I said she doesn't have any clubbing, things like that. I'm going to go ahead and just kind of palpate your scalp. Okay, Jessica? Okay, that seems good. Her face seems very symmetrical. I'm going to go ahead and ask you to, if you can raise your eyebrows for me. Okay, go ahead and squint your eyes. Perfect. Puff your cheeks out and smile for me. Perfect. Okay, and that's cranial nerve number 7. I'm going to go ahead and just palpate your TMJ. This is just a joint right here. You can go ahead and open and close your jaw. Perfect. Okay, thank you. That was cranial nerve number 5. So I'm going to go ahead and inspect your eyes now. I'm going to use the pen light for that. And just looking at your eyes, your conjunctiva, excuse me, your scleras are good. Good. Conjunctiva looks good, nice and pink. You look like you have, like you're looking around appropriately. So I'm going to shine this pen light in your eye, okay? Okay, she's got nice brisk reflexes. And I'm going to go ahead and look for direct and consensual reflexes. Okay, so looks like she is good with that. If you want to look straight ahead at my pen light. Okay. And then I'm going to also test your movement, your eye movement in the six fields, okay? So if you want to just follow my pen. Perfect, not even moving your head, excellent. So that is cranial nerves 3, 4, and 6. So now I'm going to go ahead and just look at your ears. They look like they're symmetrical. They're aligned nicely. I'm going to look at your pinna, which doesn't look red or irritated in any means. I'm going to go ahead and look in your ear canals. Okay, so you're going to feel me just pull up and back. Okay, looks good. She's got nice pearly white, clear eardrums, or her tympanic membrane, excuse me. And her ear canals look nice and clean. No blockages. That's cranial nerve number 8. Okay. So I'm going to go ahead and do some tests for your, oops, here we go. Just looking for my tools, sorry about that. I'm going to go ahead and do some hearing tests. You're going to feel me put this on the top of your head, okay? This is the Weber test. So you go ahead and tell me whenever you're done if you can hear that.
Yes.
Can you hear it on both sides?
Yes.
Perfect. Okay, and then on her mastoid bone, we're going to go ahead and check on each side. Tell me how long you can hear that for.
Good.
Okay, and tell me if you can hear it now. And these are cranial, sorry, this is cranial nerve number 11.
Okay, good.
8, sorry, 8. Good, okay, I'm going to check on the other side. For time purposes, we're going to do the exact same thing that we already did. So now, just since I'm already here, I'm going to go ahead and just palpate that mastoid. Okay, everything feels normal there as well. So I'm going to put my little test thing away here. Now I'm going to go ahead and look at your nose. Her nose looks symmetrical. I'm going to palpate your sinuses while I'm here. Okay. Any pain or discomfort with that? No. Okay, and so those are the frontal, ethmoid, and maxillary sinuses. So I'm just going to have you tilt your head back a little bit for me. I'm just going to look up here. Everything looks good there. So if you can go ahead, while I get rid of this, if you can go ahead and, I just want to check patency. Go ahead and push. Perfect. On the other side? Great. Excellent. Okay, so now I'm going to go ahead and inspect your mouth. I don't know why I took that. Oh, here we go. Okay, so if you want to go ahead and open your mouth, say ah. Perfect. Stick your tongue out, wiggle it around for me. Excellent. I'm going to have, I would typically have some kind of a tongue depressor to check her gag reflex, but since I like Jessica, I'm not going to do that today, and that would be 10, 11, and 12. Sorry, I'm having a hard time staying in your field of vision here. Sorry, guys, if I step out. So after I checked her oropharynx, I'm going to go ahead and just kind of inspect her neck. Everything looks good. Her skin looks good. No lumps at all. Lymph nodes feel normal. Okay, I'm just trying to think here. I'm going to go ahead and listen for some bruise, which I'm going to go ahead and hope she doesn't have. Sounds good. Good again. Okay, perfect. So if you can go ahead, Jessica, and just put your finger on your nose, we're going to go ahead and do, you can touch your nose to my finger, or your finger to my finger a few times. Perfect. Okay, and then with your hands, I'm going to check. You can go on your hands back and forth. Perfect. Okay, all that coordination looks great. So now I'm going to have you go ahead and stand up for me. I'm going to have you do a few things. Sorry, I probably could have had you do this while you're sitting. Maybe you can sit back down for me. If you can run your heel to shin on both sides. Perfect, excellent. Okay, now you can stand up. Go ahead and put your feet together, hands to the side, close your eyes. Okay, she's not falling over. That looks great. So now I'm going to have you walk. You can walk right this way towards the wall. Perfect. Gait looks nice and steady. Now you can go heel to toe. Okay, you walk on your heels and on your toes. Okay, she's very steady on her feet. Looks great. And then before you sit down, I'm just going to have you do a real shallow knee bend for me. Great. Okay, perfect. So I'm going to go ahead real fast. For the sake of time, we're going to do this on just a couple. All right, we're going to check her sensation. So Jessica, if you can close your eyes for me, I'm just going to do, I've got this little brush, and then I also have this little pokey thing. So I'm going to check for sharp or dull. You can tell me what you feel, okay?
Sharp.
Okay. I'm going to go ahead and check your arm.
Sharp.
Okay.
Dull.
Okay.
Dull.
And then I would check her legs, but she's got pants on, so she would have a gown on for that, and it would be a whole lot easier to check that. Okay, so since I've got this handy-dandy little tool, I'm going to check some reflexes here. I will check her. All right, sorry. She's got this really nice sweater on, which makes it a whole little bit easier. Okay, so we're going to check her bicep. Okay, good. Tricep. Brachial. Okay, I'm sorry. Sorry, there you, that really jumped pretty good, didn't it? Did you do that yourself? Okay, so we're going to go ahead and check her patellar. Oh, it's good. That was good. Okay, and her Achilles. Sorry, guys, if I'm trying to stay in your line of view here. She's got some shoes on. We wouldn't have any shoes on either. We would check her Babinski reflex, so I'm going to go ahead and rub this up the bottom of her foot and hope that she curls her toes in and not fan out. We would also check with this tuning fork. I would also hold this on both of her big toes. Since she has shoes on, I'm not going to do that, but we'd be checking for vibration. So I would check that, hold it to both of her big toes and her hands. So now that we're done with that, I would maybe even before she came into the room, we would do her Snellen eye chart and just hold that out 20 feet. That's checking cranial nerve number 2. And today Jessica has 20/20 vision, so that's a good day. So now we're going to check her heart and lungs. I'm going to go ahead and listen. Before listening, I'm going to just go ahead and inspect. Everything looks normal. Her breathing doesn't look labored. She does not appear to have a barrel chest. Her AP diameter looks normal, which is 2 to 1. And then her breathing and everything seems to be symmetrical. So we're going to go ahead and auscultate front and back. Okay, and for the sake of time, I'm not going to listen to a full cycle. Okay, then I'm going to go ahead and listen in the back. Okay. While I'm here, I'm going to go ahead and come around this back side. Hopefully you guys will be able to see me. Thank you, Jessica, for turning a little bit. So I'm going to go ahead and check her. Excuse me, now I'm a little bit further away from her. I'm going to go ahead and thank you, check her respiratory excursion. So I would go ahead and percuss all the way down until I found the bottom. Go ahead and take a nice deep breath and then let it all out for me. Okay, and then I would do this on both sides. And then I would measure to see her excursion, the difference for her excursion. So now I'm going to go ahead and check. If you want to take a nice deep breath for me. Okay, one more time. Okay, perfect. And we're looking for 3 to 6 centimeters difference, I believe. And then if you want to go ahead and say 99 for me.
99.
One more time.
99. 99.
Okay. And go ahead and check that in the front.
99. 99.
Okay, perfect. So I would go ahead and check all your pulses, on your wrist, your pedal pulses, that kind of thing. While I was listening to your respiratory status, I'm listening a little bit to your heart. So we've got the, I'm going to check first aortic, pulmonic, Erb's point. I'm going to go ahead and check tricuspid, and then also her mitral. Obviously, this would be a whole lot easier if she had her gown on, and I would go ahead and do this with the diaphragm of the stethoscope and then flip it around and do it with a bell as well. For sake of time, I'm not going to go through all of those again for you. I already said earlier she's got great cap refill. I'm just trying to think anything else. Is there anything else about the your current situation that you'd like me to know? No? Okay. Her abdomen, I would be checking. It looks fine. She doesn't have any scars. Go ahead and if you want to lift your head up for me. Okay, she's got no hernias. That looks good. No rashes, lesions, anything like that. I'm going to listen to all 4 quadrants. She's got great ball sounds. Nothing sounds abnormal. Listen for bruits. Okay. I'm going to go ahead and lightly palpate. Tell me if you feel any discomfort. Anything? No? Okay, perfect. I'm going to go ahead and help you sit yourself back up. Okay, so last thing, I want to just go ahead and check musculoskeletal. And I'm going to go ahead and have you turn your head against my hand. Perfect. Great. So she's good. You're kind of fast on the jump there, Jessica. Okay. Go ahead and raise your shoulders. Perfect. That was cranial nerve. Oh, sorry. Number 10. No, 11. I'm sorry. 11. Okay, so I would go ahead and inspect all of her joints. Move her around, her shoulders, her elbows, her wrists, her hands, knees, feet, toes. And I'm just going to make sure she doesn't have any discomfort with those. Nothing seems out of place. Her spinal alignment is correct, which I already kind of checked when she walked. So I'd like to thank Jessica for helping me with my video today, and thanks for watching, guys.